Radiography as a field is one of the fastest growing professions within healthcare. We are currently the third largest healthcare profession behind physicians and nurses. So we are like little detectives. We are in there helping diagnose patients so that the doctors can order a treatment plan and the nurses and other healthcare professionals can carry out those plans.
I have found that this program and just being a radiographer in general, it's something different every day, and I like that. I like that it keeps me on my toes, and I feel extremely prepared to have a career in this path in the medical field. So,
one of the things that KCC offers that makes us stand out from other programs, I believe, is our state-of-the-art live X-ray lab that offers the latest digital technology, so students can practice doing their X-ray exams prior to going into the clinical setting. We have surgical equipment that the students get to practice taking X-rays during a surgical procedure. In addition to our energized X-ray lab, we have an adult mannequin, a pediatric mannequin, and a neonatal mannequin that our students have the opportunity to X-ray individuals of all age groups, and that makes them better prepared to safely administer ionizing radiation.
The equipment in this lab here that we have at KCC definitely is comparable to what we use at the hospital, so it is a good first stepping stone to be able to get comfortable using that equipment so that when you're in the clinical site, you feel comfortable using that as well.
Majority of what we do at clinical is just, when we first get there, we kind of observe because we're still new students. We still am kind of learning the flow of the hospital that we're placed at. I think it helps having a lab class before we go to learn different positioning and like techniques and everything. It helps us a lot for clinical because we're prepared and we know how to do certain exams. And I think clinical is also good for the patient care aspect.
At clinical, you are kind of an X-ray tech. You are, of course, under someone. You're being supervised at all times, but you do get patients, you take their X-rays yourself, and you're kind of just an X-ray tech with that assistance. So it's really cool to be able to kind of see firsthand right when you start the program what it's going to look like for your future.
I think having clinicals at a place where you can see your future self working after graduation is great. All the techs that I've worked alongside are great, and they're definitely people that I can see I'll be working with for a while down the line.
The job outlook for radiography grads from Kankakee Community College is very promising. For 12 years now, we have had 100% pass rate on our national certification examination, and we also have had 100% job placement for the last 5 years.
The site that I'm at clinicals at right now has talked to me a little bit about what my plans are after graduation, if I would be interested in working there, so that's definitely an option.
I would recommend the KCC radiography program to anybody who's interested in the medical field. I think that it's a great start and it kind of eases your way into it. I think that KCC does a great job of making you feel comfortable before any career that you're going to go into. I feel fully prepared, and I would just recommend that to anybody.